We start today with new insight on health insurance. As expected, enrollment through the state's marketplace for coverage beginning January 1st is down. Take a look at this new data. This is now just being shared with Maine Total Coverage. Compared to last year, enrollment is down roughly 7%. With ACA subsidies expiring, premiums are set to increase dramatically for thousands of Mainers. And because of that, an estimated 5,700 have canceled their coverage for 2026. For the latest on the health insurance outlook, we're sitting down today with Bob Carey, the superintendent of Maine's Bureau of Insurance, and Hillary Schneider, the director of the Office of the Health Insurance Marketplace. So open enrollment is now over for coverage beginning January 1st. What does the landscape look like? Did people waive coverage who think that they're not able to afford it? Did signups meet expectations? What's the status?
Overall, have seen a decline in enrollment year over year. So we're at about 7% fewer consumers than we were at this point last year. We've also seen a decline in enrollment since the beginning of open enrollment, which is not typical.
An estimated 5,700 Mainers with insurance purchased through the marketplace have canceled renewals for 2026, according to Schneider.
The other trend we're seeing is people are choosing health plans that have higher out-of-pocket costs. And so because those health plans have lower premiums, but they have more cost exposure for the consumers.
What Carey takes from these numbers is that he says healthcare is critical, and cost increases mean some Mainers will go without other things. He hopes the conversation shifts beyond insurance costs to healthcare more broadly, including prescription drugs and hospitalizations.
The conversation today, or most recently, has been about the individual market and the subsidies that are available. But that's, while important and critical, it's still 6 to 7% of the total population, and the 94% of the population that gets their health insurance or health care. Otherwise, they are affected as well.
The group perhaps most vulnerable to the increase in ACA plan premiums, they say, are small business owners.
They're angry that they have to figure that, that the health coverage is not affordable to them. And they're angry that people are saying to them that they're not deserving of health care coverage. And so we've been really working to help people. But we also hear from people who, are at that point where they're seeing a tripling of their monthly costs. So their premiums last year were $200 and now they're over $1,000, and they don't understand why, and they're scared.
With people desperate to ensure coverage, scam reports are up too.
These folks are preyed upon by scammers who call them or text them, or if they open up the internet and they click on a link and provide a little bit of information, and they get deluged with information that's not correct. And that, to me, is will be a consequence of this open enrollment period. And it happens for Medicare eligible people as well as non-Medicare eligible people.
You mentioned how it might be later, several months into 2026, that we have a greater idea about how all of these conditions are impacting the health insurance marketplace. Can you explain why that is? It sounds like there are a lot of people that are in economically really challenging positions, are using all of their available resources to make sure that they're not going without coverage, but who knows what they're going to be able to afford going forward. Is that a fair characterization?
People go to great extremes, especially if they have healthcare needs or a history of healthcare needs, to afford coverage, and those increases may be unsustainable for them. I think we're not going to really see the shakeout from this until, at least through the spring of next year.
While premiums are increasing, Schneider wants to make clear there are subsidies still available. What is the outlook like from Augusta towards Washington, D.C. and the action or inaction from Congress? Does hope remain that they're going to get something done here that's helpful?
It'll be interesting to see what happens when folks go home, meaning the folks in D.C. go home. I mean, our congressional delegation is supportive of extending the enhanced subsidies.
And for those who did not enroll in a plan before the deadline for coverage starting January 1st, there is still time to sign up for a plan. And if you're looking for insurance, CoverMe.gov is offering plans for 2026. The deadline for coverage starting February 1st. That's coming up next month, January 15th. For help signing up or to get your questions answered, you can call 1-866-636-0355. If you suspect any sort of scam or need support from the state's Bureau of Insurance, you can call 1-800-300-5000.